What is hepatitis B? Hepatitis B is a virus that attacks the liver. Hepatitis B infections are also known as a silent epidemic because many people who are infected do not experience any symptoms until years later when they develop inflammation of the liver, cirrhosis, or even cancer of the liver. Every year on average, about 3,000 people die from cirrhosis, liver cancer, or other complications caused by hepatitis B. It can be an acute short-term illness which can lead to a loss of appetite, tiredness, pain in muscles, joints and stomachs, jaundice, diarrhea, and vomiting. Hepatitis B virus is easily spread through contact with blood or other bodily fluids of an infected person. A person can also be infected from contact with a contaminated object, where the virus can live up to for 7 days. What is the hepatitis B vaccine? It is an injection used to help prevent infection from the hepatitis B virus. It is a genetically engineered piece of the virus. It does not contain the virus, so you cannot get hepatitis from the vaccine. The hepatitis B vaccine is considered one of the safest and most effective vaccines ever made. The vaccine works by helping the body produce an immunity through antibody production that will prevent you from getting infected with hepatitis B. The Hep B vaccine does not protect you against other infections such as HIV, hepatitis A, C, or E, HPV virus, and other problems. The vaccine gives long-term protection. There are a few different vaccines currently being used among infants, children, and adults. Who should be vaccinated? The vaccine is recommended for people of all ages, especially children, and those at an increased risk of getting the infection. Those at an increased risk can include healthcare personnel, lab workers, police, fire, and emergency personnel who give first aid treatment, dialysis patients, people with multiple sex partners, people that live with someone who has chronic hepatitis B infections, and people traveling to high-risk areas. How is a hepatitis B vaccine given? The vaccine is given by injection into a muscle in your shoulder or thigh and done by a healthcare professional. A series of 3 to 4 injections are usually given over a 6 to 12 month period. Your doctor will give you a vaccination schedule, which must be followed very closely for maximum effectiveness. The dosage and vaccination schedule is based on your age, medical conditions, risk of hepatitis B exposure, and which brand of vaccine being used. At the time of your initial injection, if your doctor feels you may have been exposed to hepatitis B, you will also be given an injection of HBIG, hepatitis B immune globulin. HBIG is a dose of antibodies that help protect you against the virus by offering immediate protection from a possible developing infection. These antibodies only last a few months. The long-term protection is gained from the HP vaccine. What are the side effects? Possible side effects include pain, soreness, redness, and swelling at the injection site, fever, tiredness, sore throat, nausea, diarrhea, loss of appetite, and dizziness may occur. If any of these effects persist or worsen, please speak with your doctor promptly. This vaccine is not recommended for those who have yeast allergies or those who have had an allergic reaction to a previous dose of the vaccine. What are the risks? The hepatitis B vaccine is a very safe vaccine, and most people do not have any problems with it. A vaccine, like any medicine, can cause a serious reaction, but the risk of it causing serious harm or death is extremely small. More than 100 million people in the US have been vaccinated. How can I learn more? Please give professional gynecological services a call today for more information or to make an appointment.